Hi, welcome everyone. I am excited that you have joined us today for a very important conversation. July is Fibroid Awareness Month, and as such, we are here today just to give you a little bit of background information. I want to share just one or two slides to give you some information about advocating for my uterus. Please give me the opportunity to share. 1 second, please. So in terms of the schedule of events today, I'm going to give you some background, and then session one is with myself and Dr. Erica Marsh. I am so honored that she is here today, and it's going to be on causes, symptoms, and treatment as pertains to fibroids. We're going to have a small break, and there's going to be some giveaways. Then we'll go into session two, which is fibroids and mental health, with Renita Bingham and Meredith Hurston having that conversation. And then lastly, we're going to have a fibroid and self-care session with some gentle chair yoga with Jasmine Hall. So where did this come from? Essentially, it came from, and it was created out of a situation that I went through. A couple of years ago, I was diagnosed with fibroids around 2009, 2010, and I did have a minor procedure, which is called a laparoscopic myomectomy, to remove fibroids. The physician, that particular physician, as well as my primary gynecologist, continued to watch my fibroids over the years, and there were a couple that started to grow. Now, while they were growing, I was not having any, really wasn't having any major symptoms. My iron did start dropping, and that was when I noticed that there was actually an issue. The first time and the second time was because my iron, my hemoglobin levels dropping. As such, I went to a hematologist. I went to that particular physician, again, the specialist who treated my fibroids the first time, and he was very nonchalant. And he was like, excuse me, just get a hysterectomy, really nonchalant. And I knew that where I was, that it didn't necessarily warrant that. Again, no major symptoms. The iron at this point was corrected. And so I left, got in my car, actually started crying, called my primary gyne, and she was like, okay, wait, calm down. The researcher in me kicked in. My background is in clinical research, and the researcher in me kicked in. When I got home, I just started searching for fibroid specialists at University of Michigan, at Emory, at Hopkins, at Cleveland Clinic, all the top institutions. And I came across a profile of Dr. Erica Marsh. I came across her profile, read her bio, even looked at some of the research that she's done on fibroid research, and the next morning I made an appointment. When Dr. Marsh and I ended up seeing each other, and when I went for the consultation, it was amazing. Everything was amazing. She looked at the records that I actually sent her, and she's like, yeah, essentially like, yeah, I don't really see where you need a hysterectomy based off looking at the records. But I still went for some additional imaging. And fast forward, I moved to DC, to the DC area. Dr. Marsh recommended a phenomenal physician who is my current gynecologist here, Dr. Sean Davis-Walensky out of Foxhall OB-GYN. And I started seeing her. She, same thing, imaging. And then we decided to go ahead and move forward with surgery. Now the surgery, the fibroids were getting larger. However, again, there wasn't a lot of like major symptoms. So pain was never an issue. Cramping was never an issue. But it was the iron levels. And then also I did start feeling like there was a little more frequent urination. And so I could tell that one was pressing on the bladder. To control the cut and to control the timing, we went ahead and decided to move forward with the full open procedure. And so when I had the procedure last September 2021 at Sibley in DC, when I woke up, when I was in recovery, and Dr. Davis-Walensky, she goes, told me that, everything went well. And she proceeded to tell me that they removed all the fibroids. So she said, we removed them all. I know that you're prone to them. So I wanted to make sure we took everything, even the smaller ones, but you still have your uterus. You did lose a lot of blood. And it was really funny because the first thing I said was, what's my hemoglobin? Because the iron was still on my mind in terms of hemoglobin. And so we have a joke now, Dr. Davis-Walensky, my niece Kiera, and myself, about my hemoglobin. Because when she went to share with Kiera that I was out of surgery, Kiera looked a little nervous and she's like, oh, she's fine. Trust me, she's coherent, and she's asking about her hemoglobin. She's completely coherent. She's good. So with that, literally what ended up happening is I ended up thinking about it. I was happy that my uterus was saved, but I began thinking about the women who may not have had the options that I had. A lot of times we talk about privilege as it pertains to race, and then I had to realize I still had my uterus because of privilege, because I have experience in the healthcare industry, because my background is public health, because I have research experience, because I knew what to do. And I knew that I could get a second opinion. I knew that I could get a third opinion if needed. I knew that. And then I had insurance that allowed that. And so from there, and with the push from Dr. Sean Davis-Walensky, which I'm grateful for her, that is where Advocating for My Uterus was birthed, to ensure that we are providing education, awareness, advocacy tools for women, as well as those who love women, who are dealing with uterine fibroids, polycystic ovarian syndrome, endometriosis, heavy cycles, menopause, and even a branch or arm of it dealing with period poverty and young ladies in school, teenage girls who may not have access to sanitary napkins, to pads, to tampons, etc. So I do want to thank the board, myself, Shanita Colbert, Meredith Hurston, Dr. Lenise Hutchins, Kiata Sumter, Jasmine Hall, as well as Misha Thomas, for assisting with this particular project. So with that, I don't want to belabor. I am so happy again that Dr. Erica Marsh is here. I told her before we even got started, and she knows this from when I was in Michigan, what I think of her. I think that she is absolutely amazing. She has a plethora of experience. She is at University of Michigan in Ann Arbor. Prior to that, she was at Northwestern. She is a Harvard graduate, and I'm only telling a little bit because you can Google her, okay? She is phenomenal. You will find, I just really think you are the epitome of Black girl magic. But you can Google her and find
Do not Google me, please.
about Dr. Erica Marsh. And again, thank you so much, Dr. Marsh, for being here. I really do appreciate you. And thank you for, again, I'm grateful that I found you, that I researched and I found you at University of Michigan. I'm grateful for your knowledge and insight. And again, I do attribute, part of the reason why I do have my uterus to this day to you. So thank you.
Well, thank you for this incredible opportunity. Thank you to the board. Thank you to the attendees for being up and at a session like this on a Saturday morning. Thank you for shedding light on a condition that is all too common, particularly in women of African ancestry, but that we still know relatively little about, given its prevalence. I am so honored to be here, particularly during Fibroid Awareness Month, the month of July, and want to compliment you and the board and everybody that helped make this event happen on making it happen, because I'm a firm believer in patient advocacy. I firmly believe that change in this field, and then in our understanding of fibroids and in available treatments and how we educate patients about fibroids, is going to come from a strong and active and vocal patient base. So keep doing what you're doing. Know that it matters. And again, I really thank you. I'm not going to pretend to go over everything I've learned in the last 20 years of my career in 15 minutes, but I do want to spend a little bit of time with some slides talking about fibroids. Then I'm going to just talk off slide, as you will, if you will, about the different treatment options available. And I want to caveat that by saying, you know, I'm not a fan of TV medicine. I am a huge fan of patient education and patient empowerment. But I don't want you to think of this as a time for you to diagnose yourself and say, hey, okay, that's what I'm going to do. I want you to think of this as an opportunity to say, hey, I have some of those symptoms, or I know I have fibroids and I'm having this and this. Is this a time where I need to go have a conversation with the healthcare provider? And if you don't have a trusted healthcare provider that you feel comfortable having a conversation with, is this a time for me to find one? For me to invest in myself in that way? For me to find somebody who I trust, who I can have a shared decision with, and plot out a plan, because I deserve to lead a healthy life where I can be my best self. And at the end of the day, that's what I want for you. That's what I want for me, for my family, for people that I love, and that's what we all deserve. So with that, I'm gonna jump in. Now, I am not technologically, you know, at the top of that curve, but I'm gonna start trying to share some slides. And Dr. Evans, if you can let me know if I am full screen.
Not full screen. Yes, you're full screen now. Thank you.
Okay, wonderful, wonderful. Thank you. And I was just like, as far as I know, we might be looking at my work schedule for Monday, but I just wanted to make sure. So, so we're going to talk a few minutes about uterine fibroids. I do want to make some disclosures that I consult for a couple of companies. I'm not going to be talking about any specific drugs. I also do research that's funded by the National Institutes of Health, or NIH. I want to disclose that, but that this is a very general talk on fibroids. So what are fibroids? Fibroids, the medical term for fibroids is leiomyoma. You may have heard a healthcare provider use that term, and it's from a Greek road. A number of Greek roots, meaning smooth muscle tumor. Okay, that's where the word leiomyoma comes from, smooth muscle tumor. Here's a picture of a fibroid that's been taken out of the uterus, and here's a picture of an entire uterus that's been removed. And if you can see, the whole top of the uterus has been cut in half and opened, and the entire top of the uterus has been replaced by a fibroid that you can see here. Now, you can have one fibroid, no fibroids, or multiple fibroids in your uterus. I think the most I've ever taken out in a single surgery is about 56 fibroids. There's some patients that have more than that, and there's some that have many, many fewer than that. What fibroids look like is that they're well circumscribed, meaning they have very clear borders. You can look and see, very clearly, like, okay, this is where it starts, this is where it ends. This is where it ends. They're shiny, they're white and rubbery when you cut into them, and they vary in size from being microscopic to about 100 pounds. They're composed of irregular bundles of what we call connective fibrous tissue, and that is the reason why we call them fibroids as a lay term, as the more common lay term. I think a huge point is that they account for up to $34 billion in costs directly. That includes direct healthcare costs, but also the indirect costs, the cost of the lost income from people staying home, from people having to spend money on menstrual hygiene products, from all the things that we don't necessarily key in on, but are meaningful nonetheless. So why do we care? Why do they cost $34 billion a year? And that's really because of their clinical presentation. Now, the only good thing about fibroids is that, between a third and half of people who have them actually don't have symptoms. They're found incidentally, or they're never found at all. There are plenty of women who go through life and never know they have fibroids, but the fibroid is just sitting there and may grow. It may shrink over time. It may stay the same. But I'd say up to half of women who don't have them, who have them don't have symptoms. And the symptoms that they have, if you do have symptoms, vary depending on where the fibroid is and how big it is. Now, this is a drawing of a uterus. Here's the uterus. I'm showing my arrow right here. And this is a drawing with a number of different fibroids, some on the surface or the outside of the uterus here, and some in the wall of the uterus that you can see here, and then some on the inside of the uterine cavity or the womb, which is where a pregnancy would implant if you were trying to get pregnant. And so, as you can imagine, and we'll talk about this a little later, where the fibroid is, how big it is, if it's in the front, if it's in the back, if it's in the inside or outside, those are the things that are going to drive symptoms. And what are those symptoms? The primary and most common symptom is abnormal uterine bleeding, or of the heavy menstrual bleeding subtype. But patients also come in with pain, particularly during their period, severe cramping during their period. That's largely related to the bleeding, but also pelvic pressure symptoms, infertility, and pregnancy loss. So we were talking about the symptoms. Now, this is, I think it's really important for us to understand our own anatomy. And this is a drawing of one of us that's been sliced down the middle, and we're just looking inside. And what you see, this is the front right here, and our backside right here. And what you see, this is our pelvic, that bone that's in the front of our pelvis. This is the bladder right here. The uterus is behind the bladder. This is fallopian tube and ovary shown here. And this is the colon and rectum behind the uterus. So if we start from the front, moving back, we have bladder, uterus, colon, and rectum. All right. So if we have a fibroid on the back side of our uterus that's growing, it's going to be pressing potentially on our lower back. It's going to be pressing potentially on our colon and rectum, depending on where it is. It may not be pressing on any of this, depending on where it is in the back of the uterus. But this patient may come in reporting lower back pain, may come in reporting constipation. Whereas this patient who has a fibroid in the front of her uterus that's pressing on her bladder that grows, may be the patient that comes in saying, I feel like I have to go to the bathroom all the time. But when I go, it's not like my bladder is full. I just urinate a little bit, but I have the sense of urgency, that I have to go. And this patient who has a fibroid down here in her cervix or at the bottom of her uterus, may be the patient that comes in saying, Dr. Marsh, I'm having a new, pain during sex, during intercourse, or I'm having bleeding every time we have intercourse, and I can't tell what that's from. Now, you could have all fibroids in all these places and not have any symptoms at all, or you can have fibroids in, some of these places and have some of these symptoms and everything in between. But just want to give you a sense of our anatomy, where the uterus lies, and therefore when fibroids are in the uterus, how they cause symptoms. You saw the drawing, but I want to show you this picture so that you can see that it's not just a drawing that has a bunch of fibroids in it, that the uterus actually is very enlarged, can be very enlarged, and can be very misshapen and distorted, if you will, from fibroids. And this is, normally your uterus is about the size of your closed fist. And this is, or even smaller than that, even thinner than that. It's not this wide typically, but if you draw a picture of the outside, it's about this size. And you can see this uterus is markedly enlarged. So what causes fibroids to grow? One of the main growth factors that we know is sex steroids or estrogen and progesterone. Okay, estrogen and progesterone. How do we know that? Well, we know that because we don't really see fibroids in girls before they start having a period, or females before we start having our period. However, when we hit that reproductive window where we're menstruating, particularly in what we used to think was really our late 30s and 40s, but now we know, particularly for Black women, this is starting in our 20s and 30s, yes, and continuing through our 40s and 50s. We see the fibroids develop. So again, this is a uterus here, ovaries, fallopian tubes, and these red circles represent fibroids, and we know those fibroids grow. And part of that growth is certainly in response to estrogen and progesterone. And then we know that in menopause, however, whether it's natural menopause, where we just stop having periods, our ovaries stop functioning, or if it's surgical menopause, so you have your ovaries taken out as part of surgically, or if it's medical menopause, where you might be on a medication that causes you to go into a temporary menopause, like leuprolide acetate is as well as a GnRH antagonist. Any GnRH agonist or antagonist could do that, where we see ovarian function decrease, and we also see fibroids shrink, and we don't see fibroids growing. And so much so that if you are postmenopausal and you say, oh, my fibroids are starting to grow, then you need to go see your doctor immediately, because your fibroids should not be growing after menopause. And if they are, it may not be a fibroid. I would say it's probably not a fibroid. And just go see a doctor to make sure you get assessed to find out what it is. All right, don't wait on that. But we know sex steroids, again, the two sex steroids in females are estrogen and progesterone, contribute to fibroid growth. But we know that the pathophysiology, or what causes fibroids, is very complex. We know that two normal or quiet cells might be sitting together, but one of those cells turns into a fibroid cell. And this is not a PhD science lecture, but I do want to show you some of the things that have been identified that may contribute to this quiet cell becoming a fibroid cell, and then may contribute to this fibroid cell replicating itself and laying down many cells, and to those cells laying down a profuse amount of extracellular matrix. Those are the factors. But this is interesting, important. But why do we do what we do? Or WWD. Why do we do what we do? As researchers and scientists and clinicians, the basic science is very interesting. The genes, the chromosomes, what's happening on the cellular level, what's happening at the tissue level. But why we do it is because of the patient, and the fact that we want to have patient-centered care, or believe in patient-centeredness. Now, what is that? That is healthcare that establishes a partnership between practitioners, patients, and their families or loved ones when the patient wants that, so when appropriate, in order to assure that decisions respect patients' wants, needs, and preferences, and that patients have the education and support they need to make decisions and participate in their own care. So, that is patient-centeredness. We shouldn't even have to write it down and talk about it, but we do. And in synopsis, what is it? It's the right care in the right way at the right time, or even more succinctly, nothing about me without me, meaning nothing happens to you without your input, without your voice. And that means picking the right treatment. That means opting to not be treated and understanding the consequences of that. That means feeling safe and reassured that you are aware of all of your options. and having your life priorities be at the center of the decision-making process. And what's an example of the provider-based perspective versus the patient voice? You know, I might see a patient, they come in, it's a 43-year-old woman, G4P3, meaning she's been pregnant 4 times, she's had 3 kids. She comes in with a 24-week size fibroid uterus, meaning her uterus is the size of somebody who's 24 weeks pregnant. She's finished having kids though. She's coming in having menorrhagia or heavy menstrual bleeding, plus some pressure symptoms from her or bulk symptoms from her fibroids. And I might think, oh, the best treatment for you is a hysterectomy. That's definitive treatment. You'll never have any problem from fibroids again. But the patient's perspective, and this is a quote from some of the research I did, where I interviewed patients with fibroids, is that they viewed my uterus like it was a useless organ. They said, well, why do you want to keep it? And I said, because it's mine. And that's enough of a reason. Now, there may be consequences to you keeping your uterus. We may be limited in what we can do, but you have a right to make that choice. I may medically make the recommendation based on my training or my expertise to have a hysterectomy, and sometimes I do. I am not anti-hysterectomy. What I am is anti-forced hysterectomy. I am anti-hysterectomy to a certain group, you know, disproportionately to a certain group of women, particularly women of color. I am, you know, I am anti not letting patients know all their options, but I'm not anti-hysterectomy. I think all treatment options are reasonable and appropriate to consider and are important to consider in that decision-making process. Again, but a patient should never be forced to have any procedure or take any medication that they don't want to take. That's unethical. So here, again, provider perspective, I may see, oh, this is how many fibroids she has, this is how big they are, but this is what the patient sees. The complexity, this is a word tree taken from about 60 interviews from patients with fibroids, and where you can see all the things that they consider and think about during their fibroid journey. And basically the way a word tree works is the larger the word, the more frequently it's mentioned during the interviews. So fibroids are actually the largest word by far, but you see surgery, pain, doctor, treatment, goodness, birth, needs, months, hysterectomy, experiences, relationships, medication, ultrasound, challenge, hoping, cramps, pregnant, pretty, bathroom, research, trying, all of these things are embolization, our kids, all of these things are things that matter. So, you know, I'm going to stop sharing slides right now and just have a general conversation about what those treatment options are. Again, we're not going to have time to go to a deep dive into them, but I do want you to let you know that there are 3 main categories of treatment, okay? There's surgery, there's radiological interventions, and then there's medications that you can take. So surgeries can really fall into 2 big subtypes, different types of hysterectomy, where we take out the whole uterus, and different types of myomectomy, where we leave the uterus behind, but we just take out the fibroids, okay? Why would you get one or the other? That depends on your life goals and what you want. It depends on your risk factors. Are you a good surgical candidate? It depends on the location of the fibroids, the number of the fibroids, and what you're willing to, the risk benefit ratio you're willing to weigh, and that your provider, your surgeon is willing to weigh. And that's a discussion that you two should have together. What are the radiological interventions then as that next big category? They are largely 2 procedures, one called the uterine artery embolization or uterine fibroid embolization, where we cut off blood supply to the vessels that feed the uterus and are feeding the fibroids to basically deplete the fibroid blood supply, and that causes them to shrink over time, and that causes bleeding to decrease over time. There's also uterine artery, there's also MRI guided focused ultrasound treatment that is available. These two treatments are not available at every hospital. They are typically hospital-based procedures that you can have in a day, and are often going, you sometimes go home the same day, sometimes spend a day or two in the hospital, and may require repeat treatments and the same as surgery. If you have a myomectomy, you may need another myomectomy in a few years. If you have a hysterectomy, you're never going to need any more surgeries for fibroids because your uterus is gone. And that's really, the biggest plus of a hysterectomy, I would say, is that you don't ever have to worry about fibroids. However, if you want to have kids, if you just want your uterus because you want your uterus, then hysterectomy is off the table, and that's okay. That's okay. Now, that last big category is medication. Do we have as many medications as we should have, given that 9 out of 10 Black women are going to have fibroids by the age of 50? That 6 or 7 out of 10 of all women of all races, because I don't want to pretend that fibroids are just a disease of Black women, but that 7 out of 10 women of all, regardless of race or ancestry, are going to have fibroids by the age of 50. No, it's not enough options, but we have what we have, and with voices like yours speaking up, demanding better, demanding more, then hopefully we will get more over time. What are those medical options? They range from things as I will say basic and low risk as NSAID, so ibuprofen, Aleve. If you have mild bleeding, then just taking some of that may actually slightly decrease your bleeding and certainly address mild cramps. Birth control pills, we know, lighten menstrual cycles and don't appear, even though pills do contain forms of estrogen and progestin, they don't appear to make fibroids grow because the level of estrogen and progestin is actually so low, and it keeps your own ovaries from making their own hormones. So net, you have a lower environment with many of the pills. There are IUDs that contain medication, like a Mirena, Liletta, IUDs that contain medication that thins your lining, and that they don't treat the fibroid specifically, but what they do is they thin the endometrial lining on the inside of your womb, and basically decreases your bleeding because of that. So if bleeding is your primary symptom and you're having mild to moderate bleeding, that's a great way to treat it. And then there are also medications like GnRH agonist and GnRH antagonist. GnRH agonists, again, are typically the common name for one is Lupron. Some of you may have taken it. It's a shot that's given every month or every 3 months, and that puts you in a temporary menopause. Some of the challenges with that is that some patients do feel like they're in menopause. They do have temporary hot flashes while you're on Lupron. But Lupron is really one of the only medications that we have that both shrinks fibroids and addresses bleeding. We also have GnRH antagonist. So Orion, Myfimbri are examples of that, where you take either, depending on which, those are the 2 FDA approved forms of it. You can take 1 pill a day with one of them or 2 pills a day with the other one, and they markedly reduce bleeding. So, and there are many more medical treatment options that you have, but the main thing is for you to understand is that there are broad categories of treatment options. Each treatment option has its own risk and benefits. This is not one of those situations where it's, oh, my neighbor had that, so I'm gonna have that. Oh, my church member had that, so I'm gonna have it too. Or my sister had it, so that's what I'm gonna have. This is a moment, you know, we are all fearfully and wonderfully made, and we're all uniquely made, and all of our fibroids are unique, okay, as well. So you need to come up with a treatment plan that is tailored to you, not to your neighbor, not to your friend, not to your coworker, but to you. And that's why you having a trusted provider is so incredibly important. So with that, I'm going to take a moment of pause and hand it back over to Dr. Evans to see if we want to do a little bit of Q&A.
Absolutely. Thank you so much again. Wonderful presentation. Thank you for sharing information about the causes and everything. And I do want to share, like Dr. Marsh indicated, I want to share something personally in terms of my family. So I am the youngest of 5, 4 girls, 1 boy, same parents, but the youngest of 5. And of the 4 girls, 3 of the 4 of us, we've had 6 surgeries between us. There's 4 myomectomies and 2 hysterectomies. And like Dr. Marsh said, it was what was best for us. So the 2 sisters, they had already had children. They were done having children. So they did opt for, I don't want to deal with this another time. They had already had the previous fibroid removal and they wanted to do a hysterectomy. The goal is to make sure you have all the information so that you can make an informed decision. And with making an informed decision, this is why it's important that you have a relationship with your doctor, that you trust your doctor and you trust their recommendations, but also that you advocate for yourself. So you actually, you know your body. So then making sure that you're taking down, if you have to keep a diary or a journal and take down notes as it pertains to your bleeding, how many pads you're going through, your cramps, whatever it is, so that you can present that information to the doctor, that becomes extremely, extremely important. So Dr. Marsh, I'm going to do a quick poll with the individuals. So right now I'm asking a question, have you, so whoever you are, have you ever been diagnosed with fibroids? And of the people here, I'm just curious in terms of the number of women who are answering that they have been diagnosed themselves with fibroids. And the poll is interesting. These numbers are really interesting that I'm seeing. And it reminds me of what you said in terms of some of the data. So I'm going to end the poll. And so this is what we have. So of the people who are here, that actually everyone, I can see that everyone did not answer, but 65% said yes, that they've been diagnosed, whereas 35% said no. So then now I want to ask another question, and that is, do you know someone who suffered or suffers from fibroids? And if we are friends, this does not include me. So please don't include me, in this. Please don't include me. My family, you can, but if we're friends, because I've talked about it. So I just want to see, not including me. Oh, yes. So Meredith, you or I can't vote because we are listed as hosts. Okay, so I'm going to stop it here. And so Dr. Marsh, 91% said yes.
Wow, I want to screenshot this if that's okay. that is incredible. And again, of those who, everyone has not answered, but of those who answered, and I know there's a couple on the phone, so they couldn't answer. And then there are some people on Facebook as well. So everyone isn't answering. So 91% said they know someone who suffered or suffers from fibroids. And then the very last question I just want to quickly ask is, what was the last treatment that you or the person you know had for fibroids? Was it a wait and see? Was it a myomectomy, removal of all the fibroids? Was it a hysterectomy, complete removal of the entire uterus? Was it a radiological
form. So uterine artery embolization or uterine fibroid embolization, or if it was, I'm uncertain. Is it that you were uncertain? And I apologize, I didn't include the medication piece. And so while you are doing this, I'm going to share this with you. It was interesting because when I first found out I had fibroids, again, about 10, 12 years ago, I actually was put on birth control for the cycle because the bleeding, they ended up saying they could tell that the bleeding and my iron was dropping because of the blood. It did not seem like it was heavy to me, but it was causing an issue. And so literally what ended up happening, I was at work at the hospital, this is when I was working in research, and there was like a gush of blood. And I went to the bathroom, and I've always been one of those people who wore all black pants, like these black sort of like spank type panties whenever I was on my cycle. And I went to the bathroom, and it was literally bright red blood everywhere. And I literally almost lost it at work. And so it was bad when I was first diagnosed because I didn't know what was going on. I didn't hear anything or know anything about fibroids. So we see the people who voted, 35% say a wait and see, 25% say a myomectomy, 15 hysterectomy. I know Mia in the comments did mention she had a uterine fibroid embolization, and then there were about 25% that said that unknown.
Incredible. Oh. Can I just add on to something that you said, Joyvina, that's so incredibly important, that you didn't realize that you were having heavy periods. And I cannot tell you how many patients I see who, when I ask them, I just used to ask, are your periods normal? That's what I just used to ask, and they would say yes. And I'll be like, okay, good. But people were telling me yes, and then I was like, well, let's just check you to see if you have any anemia, just in case, because I'm a little OCD like that. And they would come back severely anemic, like needing a blood transfusion immediately anemic, and not realize it. And I'm like, how are you out walking around? Like, how are you out functioning? And that gets to that important acknowledgement that knowledge is power. If you don't know what normal is, if your mother and sister and aunties have all had periods like you're having, or they just say, look, this is just what women go through, suck it up, then you may not realize that soaking a pad every half hour for 2 weeks is not normal, or even soaking a pad half an hour for 12 hours is not normal, let alone a week. That's too heavy. So now I ask, are your periods normal? And if a patient says yes, I say, great, tell me about them. How much menstrual hygiene are you using on your heaviest day? How much? And if they say, oh, I have to, on my heaviest day, I got to change every 45 minutes or so, then we have a different kind of conversation, including when it starts with, that's actually not normal. That's heavier than normal. So let's talk about what could be causing that. And it's not just fibroids, which is why having a trusted healthcare provider is important. There are many things that cause heavy menstrual bleeding. There are many things that cause pain and painful periods. Many of which we are all underdiagnosed for, So it is important that you see a doctor, that you let them know that what you're having, and you also, it's also important that your bar should be here for you, not here. Meaning your bar shouldn't be, this is just what I have to deal with as a woman. What you have to deal with as a woman is being exceptional, being glorious, being happy, being fulfilled, being healthy, having energy, being able to take care of those you love and be taken care of, being able to be your best self. That's where your bar needs to be, okay? So what do you need to do in your life to have your bar be at a place where you can be the very best version of you? That means taking care of your health, working with someone you trust to help you get there, and then doing what you need to do not working from a space of fear, because that is not the spirit that we were given, but working from a space of knowledge, from courage, and from support, and doing what you need to do to take care of yourself.
Absolutely. Thank you so much again. I so appreciate you. I do just want to quickly share one last thing. I don't see any questions as of now, but I do just want to take an opportunity to share with everyone while this is popping up. I want to share, and this is something that is extremely personal, but I do want to share the fact that, and it is something that I am open about sharing. So while Dr. Marsh did not actually do my surgery, and we didn't do treatment per se together, I did go to Dr. Marsh for egg preservation or for egg freezing. So I did have the opportunity to serve, to be a patient of Dr. Marsh from the fertility side and from an egg freezing side. That is something we don't talk about a lot. That's not why we're here today, but I do just want to share in terms of, we don't talk a lot about fertility and egg freezing and in vitro fertilization or intrauterine insemination, whatever the case. We don't talk a lot about that, assisted reproductive technology. And so if you are in Michigan, I do just want to share Dr. Marsh's information here. I am uncertain. I should have asked first, are you actually accepting new patients?
I am. Unfortunately, my wait is long. I try to never not accept new patients, but unfortunately, I am booking out November now. So,
okay.
so I do want to share that and encourage you that while I'm happy to see anybody, I also, there are good healthcare providers all over Michigan, and within, certainly throughout U of M where I work, but also in other health systems. And the main thing is finding a place and a provider that's going to let you know all your options. So that's what I encourage. That's what I encourage. But I am happy to see anybody. And thank you, Joyvina, for sharing the information. And thank you all again for coming. I just think that so much of the change we're going to see in this space is going to come from you. It's going to come from patients. It's going to come from your lived experience, letting us know what we need to do, what we need to discover, what we need to add to the field. So Joyvina, the board members, I will be tweeting about this and, in the sense of patient advocacy, patients coming up and being able to participate in an event like this. So thank you.
Thank you so much. I really do appreciate your time. And everyone, she didn't know I was going to say this. Can you give her a round of applause? Because today she's actually, no, I do want to share. I'm excited to share this. Today she's in the DC area, receiving an award for the White Dress Project, which is essentially an organization that also focuses on women's health issues, specifically uterine fibroids and the wearing white. A lot of times we were always taught not to wear white, right, when we were on our cycle. And so the White Dress Project, please feel free to look them up. They are a phenomenal organization here. And again, Dr. Marsh is one of the award recipients. So congratulations. Thank you so much. I hope you can see Dr. Sean Davis while you're here, Walensky, if you haven't already.
I will call her.
Okay.
This is a quick in and out for me. But yeah, no, I have a couple of college roommates in the area that I need to reach out. So I'll definitely be talking to her. But you give her my love as well.
Will do. Thank you so much. I really do appreciate it.
All right.
Thank you.
Take care. Thank you, everybody. Enjoy the rest of the meeting. Bye-bye.
Thank you. Okay, so everyone, so again, Great information that we learned there from Dr. Sean Davis. I'm sorry, excuse me, from Dr. Erica Marsh. I'm still thinking about my primary care. From Dr. Erica Marsh. I do at this time, we have a little bit of a break before our next session. It's going to start at exactly 12 noon. So if you need to go top off your coffee, get some water, go to the restroom, please feel free to do that. Also, please stay connected. Advocatingformyuterus.com. You can go there and sign up and subscribe to the email list. There are a couple of giveaways as well. So we're going to give away the free private yoga session by We Are Healthy and Well, Jasmine Hall. That's going to be at the end. Please stick around. She has a gentle yoga session that she's going to offer us towards the end. Right now, we're going to do a t-shirt from Advocating for My Uterus. And this actually goes out to the first person who registered for the event. And let me go on here now to look to see who that person is. And then later on, we're also going to do another giveaway, which is going to be a book from Confidence Academy. Okay, so again, thank you all. Thank you, thank you, thank you. And let me find out who was the first person who registered. For those of you on Facebook, thank you for joining us on Facebook. We appreciate each and every one of you. Okay, let me find the list. Okay, so the first person to register who gets the t-shirt from Advocating for My Uterus is Trisha Edwards. Trisha, I'm uncertain if Trish is actually on here right now, but Trish actually was in Florida for a national conference. And unfortunately, there was a delay. She had to stay overnight. So she actually sent me a message that she was on her way back to the airport to pick up her luggage. So Trish may not be here, but she will end up receiving the t-shirt. So I did want to share that. The next thing that I wanted to briefly share is this. So I want to be transparent and share a couple things with you. If you have a weak stomach, please go ahead and turn away right now. If you have a weak stomach in any way, shape, or form. So let me see if I can pull these images up. Okay. So this is when I was in the hospital, September 2021. Again, just being transparent. This was literally a couple of hours after the procedure. Yes, I did have a head wrap, and yes, I was completely prepared for the surgery, for the procedure. I had a bag with everything in there. Just as a FYI, I am in the process of writing a book as it pertains to my journey with fibroids. That book is also going to contain information about preparing for surgery for those who do have to have surgery, what I did to prepare. But also, while I understand that I was an anomaly with how fast I bounced back, I will say this, that health is extremely important. So my health, physical health, me working out, walking, exercising, my lifestyle, diet, lifestyle, all of that did contribute to, it truly did contribute to that process. And so then this was, I think, the next day that I was in the hospital after the surgery. But then here are the fibroids that were removed from me. As you can see, one was extremely large, the one in the bottom right. Meredith, I see you have your hand up.
Yep, excuse me. We can't see your images. We only see your drive. I'm sorry to interrupt you.
Okay, 1 second. Thank you for sharing that. Let me try to pull it up again. Can you see them now?
Yes.
Okay, so this was from the hospital. This was the first day in the hospital. This was the second day, so stronger and stronger. This was literally maybe like 1 hour after the surgery, after blood transfusion. I did end up losing a lot of blood and all of that. And I understand I was an anomaly. So like Dr. Marsh said, everyone's experience is not going to be the same. Rarely any pain. Kiera and I, we walked like a mile the day I was discharged. This is the next day. And then these are the fibroids that were removed. As you can see, the one that was at the bottom, that was the largest, and that was the one that started causing a little more of the issues with pushing on the bladder. So while it was bearable, it was not excessive bathroom use. It still just started being a little annoying. So just wanted to share that, my personal story as it pertains to fibroids and my hospital journey at Sibley. I did end up seeing a question as it pertained to doctors. There is on Facebook, it's called blackdoctor.org. I believe they may actually have a list of doctors, but one thing that I do plan on doing and that we plan on doing for Advocating for My Uterus is specifically trying to find some of the top fibroid specialists in the country and having that list available on the actual website for Advocating for My Uterus. So with that, I am going to start transitioning to Meredith and Renita. I am super happy to have both of them having a conversation about fibroids and mental health. The one thing, anyone who knows me, you know that I'm a huge advocate of mental health. It is nothing to be ashamed of. Dr. Anita Phillips, she has a shirt that I have that says, prayer is a weapon, therapy is a strategy. Okay, prayer is a weapon, therapy is a strategy. So there's nothing wrong with mental health, nothing wrong with therapy. Again, I am a huge advocate. My opinion, I personally feel that just like we have annual appointments, that everyone should have an annual mental health checkup. That is something that I believe in. Again, I said everyone. So everyone includes who? That includes me. That includes all of you. That everyone should have regular mental health checkups. I believe just like we go to the doctor annually, we should consider therapy. Just like we have to get our teeth cleaned every 6 months, we should consider those regular check-ins as well. And while I actually just found a new therapist in this area. And you don't have to go to therapy because you're depressed or there's just something wrong. Sometimes therapy is to help you maybe just talk out situations, or if you're having a transitional period. You can go to therapy for numerous reasons. When I don't go to official therapy, I do have some unofficial therapists that I do go to. So I practice what I preach. I am not a liar. I practice what I preach. So when I say everyone should go to therapy, that includes me. That includes all of you as well. So with that being said, I'm excited to have Meredith Hurston and Renita Bingham with me today, with all of us to share them with you. Meredith and I actually met at Hurley Medical Center in Flint, Michigan. And then from there, we were at Grace Emmanuel Baptist Church in Flint. Meredith eventually moved to Baltimore to start working for the Johns Hopkins University, or Johns Hopkins Medicine, excuse me. And so we have, Meredith is also on the board for Advocating for My Uterus, and I'm super excited to have her. Renita Bingham is a regional education manager for Planned Parenthood. She is also a therapist. She is very passionate about therapy, mental health, but also educating. And she's going to tell you a little more about herself, but also educating the community, the public as a whole, as it pertains to reproductive issues, concerns, periods, and all of that. Renita and I, we had the pleasure of meeting through her husband, Moses, who is at one of the foundations in Flint, Michigan. So again, I am grateful for Moses introducing us, really, really grateful. So please tell him that I said thank you for the introduction. Without further ado, I am going to turn it over to Meredith and Renita. Thanks so much, both of you.
Thank you, Dr. Joy. Good afternoon and good morning to everyone. I'm super excited to be here. I appreciate the opportunity to participate in this really important event. Hi, Renita.
Hi, Meredith. How are you this afternoon now?
Yep, I am good. So, okay, so let's get into our conversation. We are talking about, and I really appreciate that Dr. Joy saw fit to include the mental health component of having a fibroid diagnosis in this event. That's super important. That's kind of, it's secondary to the diagnosis, but it's a big secondary component. Would you agree?
Oh, absolutely. Having a diagnosis that is important, but understanding that the diagnosis is important as well, for sure.
And so I know, like, one of the biggest things I think that people, or I know for me, so I'll step back a little bit for a second and explain. So in 2013, well, I can't remember when I was diagnosed with fibroids. It was sometime after 2010. Or actually, I think I knew that I had them before, but they weren't really problematic. Probably around 2012 timeline, they started to become a bit problematic. And my doctor informed me that they were pressing, I would get routine ultrasounds to kind of check the status of them. And after an ultrasound, I believe in 2012, my doctor told me that it was pressing on one of my ureters, which that's like the connection to your kidney for, how you urinate. And so she was like, it's going to be time to do something about them. So I ended up having a laparoscopic myomectomy in 2013, January of 2013, for my fibroid. And it was a really, large fibroid. And one of the things that came to mind for me is like, well, I knew that I wasn't having a hysterectomy. I worked in healthcare for a long time as well. So I knew that the myomectomy was not a hysterectomy, but I was wondering like what the consequences were, like if it could mess up my chances of having kids. So I understand, like those mental health aspects that go along with the diagnosis. Like, well, what if something goes wrong? Just being afraid of going under general anesthesia. There's a whole bunch of like fears and concerns, that we have. So what do you suggest that women do to like help process those types of thoughts and fears?
Yeah, so thank you for that question. Oftentimes I get clients who come in and they have, they're in shock, right? You go to the doctor, you get the diagnosis, and then sometimes you hear like wah, 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 right? You don't hear anything else from the doctor. You just hear the diagnosis, and then, oh my goodness, you start to panic, or, what goes, I don't know what to do after that. So I have the unique privilege of teaching reproductive health care, right? And also as a therapist with my foundation in physiology, I understand how the body works. So I give folks the understanding and the knowledge to just hold on, just let's take a deep breath, right? And then we start to incorporate, even before we go into even before I have the opportunity to go into like what the diagnosis is and helping you process it, but giving tools for just breathing, right? Just understanding that the mental health impacts your physical health as well. So if your mental health is not intact, if you're not like thinking clearly, if your body is in anxiety mode or in panic mode, it also produces hormones that can alter your reproductive organs as well. So just taking a deep breath, helping them with those coping techniques is super important. And that's the first step, is not just, handling the diagnosis, but actually just breathing first and just getting, our breath regulated to understand that the mental health is important when understanding your physical health as well.
Absolutely. I will admit, I don't think that I was doing any mental health counseling around the time that I had the diagnosis. I think I was just sitting there scared. So my advice to people here today is don't be like me. I mean, I went through with the surgery, but I think I tried to put it off for a little bit. And that goes with what Dr. Marsh said, she didn't, take it all the way to church, but she touched on, God hasn't given us a spirit of fear. So, be courageous and, think clearly about, what lies ahead of you and seek out the support that you need to handle, your diagnosis and any upcoming surgeries and treatment options and things that they go along with that. So absolutely. So let's talk about, this is one thing I think overall, talking about women's health and reproductive health. There's a connotation, I feel like, in our community, or like a stigma, that having these types of conversations are not ladylike. So can you give us your insight on why these types of talks are helpful, and how can we dispel the myth that these conversations are not ladylike, so that we can get more women on board? Because I find that when people share their stories and we listen to their stories, we can learn so much, and it helps inform, our decisions, to help us make better decisions going forward. So let's tackle that not ladylike piece.
Yeah, so you probably got it from your mom, your granny, or your aunties, or somebody. You don't talk about that, right? It's taboo. We don't talk about, cycling and things of that nature, because it's connected to something that's very intimate. Right. And intimate conversations are often hard for folks. Right. But and then that also exasperates into a more type of beyond taboo. It gets into problematic conversations or issues that we're not equipped to have. And so when we talk about being ladylike, and it's not ladylike to have these conversations, it also creates that stigma. It creates shame. It creates unknowns. It creates anxiety. It creates a lot of different levels of impaired mental health. Let's just keep it real. When we're not able to have the discussions that we need to have, when we suppress our thoughts, when we suppress our feelings and emotions, and not able to have those specific conversations. So I know we were talking last week, and I said, I ask students, because I teach sex ed for Planned Parenthood. And one of the things that I ask them, right, we start talking about menstrual cycles. I say to those who have uteruses and who are cycling, if you were at dinner, if you were at the table, having dinner out at a restaurant, and you were on your cycle, right, and you knew it was time to change your tampon or your pad, would you get up, go into your bag, put your tampon or your pad in your hand, and walk to the bathroom? What would you say? What would the people in this room today say? Would you? I didn't create a poll, but if we were creating
create a poll right quick?
you could definitely put it in a chat. Would you be okay with just like taking your menstrual product in your hand and walking to the bathroom to do so? I'm interested. No, right. So the majority of people, today, yes, good.
So we see some yeses, probably hide it in my pocket and go, that's me. I'm a hide in my pocket type girl. Well, I was.
Sneak it in my bra, right? Dig it, in your purse. So yeah, that's one of the things. There's so much stigma and shame around, menstrual products and menstruating it in general. So why would we have those conversations? Right. So in order to have the conversations, we have to decrease the stigma around talking about it. And that's what I've started to do in the different communities that I work with, is create a normalize and help to normalize having these conversations. So, it's not like it's unladylike. It is very much okay to have these conversations. So thank you for that question. It was good.
Absolutely. And I would even dare say that it's necessary to have these conversations, and try to hold, especially in our friendship circles, to hold each other accountable. Hey girl, did you go for an annual yet this year? Have you scheduled it? Is everything good? To just kind of open the door to make, even if the first time you ask the question, it might catch somebody off guard. Girl, why are you asking me that? Yeah, everything good. But in case, or, if in case things are not good or something comes up in the future, they know that they probably can come back to you and confide in you. Because I feel like, there's this whole, strong Black woman, superwoman syndrome out here that we need to start trying to like tear down the doors, tear down the walls for that. Like, women, we need safe spaces.
Yes.
And I'm here to help create safe spaces. And I know that you are as well, and Dr. Joy, and all of our board members. We're here to encourage, safe spaces and these conversations. And so I kind of asked that question about not ladylike behavior and opening up conversations with our girlfriends, but the next one is probably a little bit even more difficult. What are your recommendations for having conversations with your intimate partner? Like if sex is painful, if your cycle is like prolonged, it's 15 days, 20 days or something like that. What do you say about having those conversations, and what can be done to like help promote intimacy?
Yeah, so that's a good question as well. One thing I say, even to young people, as I'm, teaching about sex ed and things of that nature, if you really can't have the questions about sex, should you really be having it? Right. So increasing your knowledge and challenging folks to talk to their partners about the intimate spaces that they're sharing, about the intimate engagements that they're having as well. Because it empowers you in your body and your decisions and things of that nature. When you know about your body, the more that you know about your body, the more that you're comfortable with your body, the more that you're comfortable having the conversations with other people, especially those who are most intimate with you. So I challenge everybody to do that. And so you say, well, how do I do it? Right? I don't know. I'm kind of, I don't even know where to start. So you start by asking them, do you know what a period is? Do you know what a cycle is? Do you know what I use for my during my cycling periods of time? Do you know if I could not do things myself and I needed you to run to the store for whatever reason, do you know what I use? Those small conversations open the door for larger ones, right? And so my husband, we've been together for over 13 years now, and after I've had a baby, he had to put on a pad for me, right? That's one of the most intimate things that I've ever experienced with him beyond, besides sex, right? Him seeing and changing my pads. Can you have that conversation with them, or saying like, you know what, if I needed some help changing my pad or changing my tampon, how comfortable are you with that? Right. And that can gauge them, their comfortability of having that conversation as well. So just having a little conversations like, do you know what I use? Do you know what a cycle is? Are you comfortable with having these conversations? Are super helpful to saying that, moving forward, as to I'm having pain when I'm having sex, right? It does not feel great when I'm having sex. I'm gonna go get checked out. Do you want to be involved in this process? How intimate do you want to be involved in this process with me as I go along with on this journey? And just having those type of conversations are super helpful to breaking the ice when it comes to engaging with your partner.
Absolutely. And I think what you said at the very beginning is key. Like, if you can't have, if you can't start those conversations, like, is this something that you should be doing, or is this someone that you should be involved with? That's good, because I feel like a lot of times, there's going back to like that shame, or, a lot of people have this thing about, oh, I'm a private person. Like, yeah, that's private, but being intimate is private. So you need to share that with your partner. You can't be enduring pain and not letting someone know, letting your intimate partner know, what's going on with you. So That was really helpful.
Yes.
The next question I have for you, and we kind of talked about this earlier, some of the ways that a fibroid diagnosis can affect your mental health. Like what are the ways? I think we hit on depression, anxiety, fear and risk of complication, but how can that impact your mental health, and what steps do you advise women to take?
Yeah, so like you were sharing, right? People get the diagnosis and they don't understand, they're in shock. It can also kind of trigger people into the grieving process, right? I got fibroids. What does that mean? I don't know. Is that fibroids? Is that cancer? What is that? You don't understand. And it can take your mental health on a journey that is not in a positive way. So understanding the diagnosis, right? Understanding what you're up against. I know Dr. Marsh talked a lot about the steps and the ways to treat fibroids, but there's also a process, right? Some people, like I was saying, the initial shock can be the same as the first step of grief, like denying it. No, that's not me. That's not what I heard. And then that can prolong the process as well. They can fear, go through the whole steps of grief, the anger piece, right? Like, why did this happen to me? And get stuck in that place, and then start to, spiral in that way. Also, depression and sadness, right? That can change your whole life aspect or outlook. Understanding where you are in the process, and then resignation, and maybe saying like, I resigned to, I understand this is what it is, or accepting of it. And then the difference is when you go to therapy, a therapist who is versed in reproductive health care can help you like move from that resignation to reconstruction, to, okay, here are the steps that your doctor probably shared with you that you might not have heard, right? These are what you can do next. It is not a death sentence. There are options for you. It is not the same as uterine cancer. And fibroids usually do not turn into cancer, right? So that's the whole piece. A lot of people, they think of it in a negative aspect in that way, like, oh, this is a terminal diagnosis, when it's not. It can definitely be treated and then move them on from that. But it is super important for those who are, seeking a therapist to ask the questions, like, is the therapist, versed into what I'm going through at that moment in time, right? As opposed to somebody who is, strictly, versed into like, just anxiety or like substance use disorder. Those who are versed in sexual health, those who are versed into reproductive health are super helpful to moving them on and helping them understand the process, and their diagnosis and prognosis as well is helpful.
That's good, Renita. That's really good. And I wanted to touch on something that you just said, and also kind of circle back on something that Dr. Marsh mentioned. So sometimes I know, and I've been guilty of this myself, when we go to our primary care doctor or to like our OBGYN and we get a diagnosis, that fear sets in, and it like paralyzes us, and it prevents us from moving forward. Mm-hmm. So it's important, like I want to impress on everyone, like if you've had a diagnosis, don't like let it get just let it go. Like if they were advise you to like wait and see, or if they say, look, you really need to have some sort of treatment, if you want to go get a second opinion to confirm that, or even a third opinion to confirm that, like I would recommend that you do so. Don't get stuck in fear and just say, well, I'm not going to do anything. Yeah. Because particularly in the case of fibroids, that's where you can kind of get into trouble, if the fibroid continues to grow, where your only choice may be to have a hysterectomy to correct the issue, whereas you may have had a lesser treatment choice that would have been helpful at the time had you not kind of got stuck in that paralysis. So I just want to suggest to people, like, if you get really like wigged out and afraid, definitely like try to connect with a therapist that can help move you along in that process.
And then to help you sit in your emotions, right? Not to suppress them. That's super important. I need your emotions to you to sit in them. And, so someone's to create a safe space for you to do that, right? And so that when you're in that safe space, they can coax you out of it as well. But it's super important to not suppress your feelings and emotions, because that can exacerbate your prognosis as well.
Absolutely. And I see that we have a few comments in the chat, and Joy mentioned that she was initially okay. However, she was very shocked when her physician recommended that she have a hysterectomy. And, Joy is my friend, so I know, and she already explained, the researcher that she is, she, went into action mode and was like, let me get a second opinion because I don't receive this. So, but the takeaway from that is that she did something. She just didn't sit and say, kind of resign herself to, I'm going to have a hysterectomy and just kind of put it off. She stepped into action. So that's what I want to encourage people to do is, put things into action. And then she also said that she prayed. And then I see someone in the chat said they were informed that they have a fibroid the size of a cantaloupe. And she was shocked. And I can understand. So like my particular situation, I think that, what did the doctor tell me? I might have this wrong, but I know Dr. Marsh mentioned that, your uterus is like the size of a fist.
Yes.
And they say that it's about, I want to say it's like 70 grams in weight or something like that. That's what my OB told, or my GYN told me when I had my surgery. And she mentioned that my fibroid was like 400 grams or something like that. It was huge. And it was on top of my uterus. It was like on a stalk. It was outside of the uterus, like on a stalk. And so, that's what I had to have removed. So it can be, they can be serious. And so you definitely want to stay on top of addressing it.
Absolutely, for sure.
And then let me see. I wanted to circle back on something that Dr. Marsh said. She was talking about advocating for herself. I was trying to capture a screen, or advocating for yourself is what she recommends to her patients. And also as a provider, she has that mindset that you want to, she says something to the effect of, you want to give the right treatment to the patient at the right time and in the right way, like considering, their wants and wishes. You don't just like, just advocate for a forced hysterectomy. And I think sometimes that has been our experience. So I thought it was important that she shared that. And I want to impress, upon all of our viewers today. I'm a huge patient advocate, like learning how to advocate for yourself when you have a diagnosis. Like, make sure you ask questions, make sure that you understand all the treatment options, and give yourself some time to consider like what resonates with you, like in your situation, because everybody's situation is unique. Some women want to preserve fertility. Some women are done having children. So it really just kind of depends on you and your unique situation. So as Joy mentioned earlier, like, I think she's mentioned 2 of her sisters have had a hysterectomy, and she has had, 2 myomectomy procedures, but, hysterectomy wasn't the right choice for her at that time. So you always want to consider your unique situation and make sure that you're making informed decisions for you with your provider, and, really trusting and believing that your provider has the, your best interest at heart.
Absolutely. One of the things about being a self-advocate is sometimes it just doesn't happen overnight, right? You're getting a diagnosis, and then then what? One of the things that I press upon and that I think is so important and that I've made my work kind of shaping around it is puberty education. And so one of the things that I do is I believe that we can change the narrative of self-advocacy if we start young. If young people understand their bodies at a younger age, they understand what they're going through, they can pay attention to signs and different things differently as they grow up and mature, so that when you get older and you know your body is changing, your hormones are changing, things are going along with your body that are a little different, that you can say like, uh-oh, this is different. This is not normal for me, right? And I need to talk to my healthcare provider about it. I know one of the things that I also impress upon or make sure that folks understand is what Dr. Marsh mentioned earlier, is what is normal. That is so important to understand what
Yes.
is normal, right? Just like she was saying, my mom, when I was growing up, my mom, normal for her was the extra long, always with wings, right? That was the norm. So when I started cycling, understanding like, why don't I need to use extra long? But my mother had fibroids. And so I didn't know that she used those because she had extra bleeding. And so understanding that if you're soaking a pad every 45 minutes, that is considered abnormal. If you are changing your pad 2 to 3 hours, that's normal, right? Every 2 to 3 hours you're to change it. But if you're not, if you change it more frequent than that, then you need to talk to a healthcare provider. So understanding what normal is needs not to start later on in life, but earlier on in life, and equip young people to understand and be empowered for their over their bodies and their autonomy as well.
Yes, that is so important. So I think now it might be time to move into questions. I know that we have a private question that Dr. Joy is going to ask from one of our viewers. And if you all have any questions that are attending on Zoom or Facebook, if you could please drop them now and we'll try to address them for you.
So the one question that is here, it says, what are your suggestions for strengthening your mental health post-fibroid surgery? The physical recovery was challenging for me on my mental health. Mentally, I still wonder if I will be able to carry a baby to term if I decide I want to have children. I had a myomectomy over a year ago and still struggling mentally.
Right. So the thing, like I was saying a little bit before, understanding your mental health is important. Getting those basic mental techniques or coping mechanisms in place will be useful for your life when things change, right? Our lives are not designed to stay the same. They are designed to change. And so if you understand that you get a diagnosis and you don't know if you'll be able to have children, because let's face it, the uterus sole purpose is to, create a nurturing environment for a fetus to grow and develop before it's born. So if you say like, well, I got these fibroids, I got them taken out, I don't know what's going on, I don't even know if I'll be able to have children. One takeaway that I want you all to understand is that when you're anxious, right, your body produces cortisol, and cortisol acts as a hindrance to your hormones, your estrogen and progestin as well. So it creates an unstable environment for your uterus to implant during your cycle. So knowing that, right, if you know, the more you know, right? If you know that you being stressed is not being helpful to your overall ability to have children, to create a safe space in your uterus, then our goal first will be to, one is equip you with tools to decrease your anxiety levels, and then work from there. So working with your mental health in that way is super important and detrimental to even moving to the place of realizing if or not you'll be able to have children. So getting that good foundation of healthy mental health care is important.
Yes, that was a great question. I can definitely relate. Do we have any other questions? I don't see any in our chat, and I don't see any on our Facebook feed.
So I do want to, there is a question that I want to ask, essentially to piggyback off of that question that was asked. So Meredith, can you share, if you're led, about the group that you just started, and if anyone wants to join that particular group, because that is a part of mental health. You know, you creating that group, you starting the group, you providing support for other individuals. So I want to ask you that. What did you create? Why did you create it? And how can people connect with you as it pertains to that group?
Sure, absolutely. I would be happy to. Thank you. So I recently created a peer support group for women who are childless, not by choice. It kind of goes by a few different names, but childless, not by choice, involuntary infertility. So basically women that either have had a hysterectomy prior to having children, or have aged out of fertility, a variety of different reasons. If you are aware that you are a woman that desired children and didn't have them, this is the group for you. So it's a Discord community, and Discord might be new to some people, but it's kind of similar to a Facebook group, but it's off the Facebook platform. It's on Discord. So it's it's like an app on your phone, or you can go to the website. And I'm happy to have you join. It's a safe space for women, particularly, you know, women of color, where we can support each other and talk about, you know, what it's like to come to acceptance. And I know Renita was kind of going through the stages of grief. Like a lot of women that don't have children and desire them go through something called disenfranchised grief, because there's not a lot of opportunity to discuss like what that feels like. You know, there's space given for women that have miscarriages, or, you know, stillborns, which are unfortunate circumstances, even, you know, infertility and trying to conceive. But there's not a lot of space given for women that desire children and maybe, you know, aged out of fertility or didn't meet the right partner and what have you. So this group is for you. So if you are a woman in that situation, definitely reach out to me. You can go to my website, meredithhurston.com. And my most recent blog post has a button that you can click to join that group. And we try to keep it a safe space. So I do ask you to fill out the form and provide your email address and submit a picture. I want to keep men out of the group. I want to keep people out of the group that are going to be soliciting, trying to help you figure out, you know, if you can still have a baby, that type of thing. I really want it to be a safe space. So thank you, Joy, for allowing me to share that.
Absolutely. No, I think that's really important. And, you know, and the thing, and now, you know, if all three of us can have this conversation the last couple of minutes, you know, the thing is that I also think that it's important for everyone to understand, just like with the fibroid diagnosis, that the mental health is going to be different for everyone. So initially, like I said, my shock was more hurt because I knew this physician. Like, we went all the way back, you know, and we worked together. It was someone that I truly trusted and respected. And that was the shock, like, that he was so nonchalant. And it's almost like he had an attitude, like, I mean, you know, and so that was where, honestly, the hurt and pain came from for me. And literally the next day, I ended everything. So I had the record sent to Dr. Marsh. That was the last day that I ever saw him, when he actually shared that information with me. But then I went into prayer mode. So then I literally went into, you know, prayer mode. There was a fasting, prayer, everything while I waited for the appointment with Dr. Marsh. I also went to my primary gyne, who I have a relationship with. This was a specialist that told me to have the hysterectomy. Went to the primary gyne. She did her own testing, like, absolutely not, and so it's important that, again, that you are comfortable with the physician that you have. But even if you trust them, know that, because again, I trusted this person, know that it's still okay for you to get another opinion. To make sure you have all the options. And so with that, even though, and I shared on the front end, even though I was praying about it, I still I still called Tamika, the therapist that I was going to in Michigan, and still had a conversation with her about what I was feeling, at that point. So that was something that was extremely important to me, was to at least have that conversation with her and share and get it out. Because sometimes what can happen is people are like, oh, and sometimes they can make you feel worse with the empathy or sympathy. Or sometimes people are like, well, did you think about this? Did you think about? Yes, I did. And please understand, I researched it up, down, left, right. So I want to share that as well. But then Renita, what is your take on, and Meredith, as well, what is your take on how we can support a friend? So let's say Meredith ended up, telling me that, she actually had a diagnosis with fibroids. She just found out. How, as a friend, how can you, support the friend from a professional? I'll tell you what I did, but how can, what is your thought from a professional therapy standpoint?
Yeah, so I have friends who have fibroids, right? In the age range where it's in that 60% of Black women who will, over 35, who will experience this. And I can tell you, I'm only there for them. Right? What do you need from me? Do you need me to go to the doctor with you? When you can't say the words, and then helping to provide information. I have that knowledge, but if someone did not have that knowledge and had a friend come to them and say, like, I got this new diagnosis, how can I be? First, I'm gonna give them, Meredith's link, right? Like, this is a whole support group that you can go to, and you can discuss it in a safe space. But creating those safe spaces that, non-judgmental spaces for them, to be there for them, just to talk and hear and listen. That's what a lot of people want, more than anything, is just to have a safe space to listen to them as they're going through this process, and that support in that way. How can I support you? How do you want me to support you? Right? What do you need from me? I don't want to assume that I know, but I just want you to tell me what you need from me, instead of, going down that route. What you need, just being there. What do you need?
And Renita, it's interesting that you say that, because, and this is what made me say, I know how I am. So everyone is, again, going back, all of us are different. Mm-hmm. I'm the type of person, I need my own time to process. So just like when my father died, it's like I tell people, give me some time, I need some time. I go internal. And sometimes people give you what they want. This is where the love languages come in, romantically, and in relationships as a whole. But sometimes people give you what they would want and not what you're asking for. So I know with me, with the surgery, I made it extremely clear that, I would reach out. I will reach out, because again, there was a major process because there was a spiritual component to what I went through as well. There was a huge spiritual component. And so there were still people who thought that they were an exception, to the rule. Like, okay, I know she said, she would reach out when she was ready. However, I'm still going to go ahead and reach out. And to be honest, that didn't do anything for me. That actually annoyed me, because I was not given what I needed in that space. So that's why I want to share that. And again, if you can piggyback, on that, Renita, I would love to hear your thoughts.
Yeah, so that is important, right? So many people in this day and age, we have social media, we have all the, the experts out there, everybody who's ready to give their opinion on the things, but understanding that what's best for you, and if you need the space, then you need the space. But then having that circle of friends around you that know you and know your no's and know your yeses and know your boundaries as well is super important. Because I'm like that as well. I need a minute. I got my boundaries up. I need to heal in this space. Give me some time. I'll reach out when I need you. But then some who say like, okay, Renita, we know it's been a month. I'm just going to call and check just to say, and to understand that as well. So it's important for those who say like, I need my space. And then also it's important for those who know you to be there as well in whatever way that you need to be helpful. So yeah, I like that. Self-awareness is key in these times for sure.
Absolutely. So Joy, we did have a couple of questions in the chat. Do we have time to get to those?
Yes, but I wanted to answer them outside of the mental health component. So yes.
Okay.
Yep, we do. Thank you. So if we can just give a round of applause to Renita and Meredith for this conversation. Meredith, if you can stay on briefly so we can share from our perspective. I did want to share again, thank you so much, Renita. You are awesome. I appreciate you being here and working with us. This is how you can stay connected with Renita. She has a couple of new Instagram pages, Circle of Life _wellness and Urban Puberty Party on Instagram. Okay, Renita Bingham. This is how you can stay in touch with Renita. Again, please give it up for Renita, please, please. And then Meredith Hurston, Instagram is Meredith Hurston, all together, all one word. And then her website is meredithhurston.com. And I apologize, I left the T out of both of them, but it's Meredith Hurston, MEredithHurston. Meredith Hurston on Instagram, meredithhurston.com. Thank you, ladies, so much. I really appreciate you. So then before we go to Jasmine, Meredith, the questions, what were those, the questions?
We had a question from Tiana that says, should women have different eating habits to reduce the risk of fibroids or having fibroids return? I can take that one, or I don't know if you want to.
I can, yeah, you can go ahead as well, and I'll share what I did that actually helped me tremendously from a standpoint of, because I did actually research that and change my diet as well. So okay,
because I was gonna you go ahead, because I was gonna recommend that they reach out to their provider and possibly a nutritionist, but yeah, share what you did.
Yeah, so I would say, so like Meredith said, reach out to your provider, see if there's a nutritionalist. What I did when I did my research, Dr. Marsh mentioned the fibrous tissue. And so one thing that causes, again, just one thing that causes fibrous tissue is caffeine. So I did end up decreasing caffeine. And I know some of you are like, no, especially if you have to have that coffee or a Coke or Mountain Dew daily. But that was one of the things that I actually did. And then also, I actually became a vegetarian about close to 10 years ago. And that actually helped as well. So even though, let me share that when I mentioned that I ended up having another surgery, the previous surgery, the physician left some fibroids in. So we already knew that there were some smaller fibroids that he left, because at the time it would have been more of an issue with him removing them. So he just left them. And so those were the ones that grew over the 10, 11, 12 year period. But again, you're still talking 10, 12 years, for them to get to the size that they got. So those were, again, two things that helped me. There is some information out there. So even when Dr. Marsh mentioned, estrogen, the hormones, you do know that some meats have hormones, in them. And so that's where just being careful in terms of what you're eating that has hormones as well. And again, the caffeine piece were two things that I actually did. But again, reach out to your physician and dietitian, see if there's a dietitian as well.
Great answers. And I know that there's some research out there about like estrogen dominance and things like that, but there doesn't seem to be a lot of consensus in the medical community. That's why I was recommending that, you know, you reach out to your provider to get some recommendations, if they have any recommendations about diet, because some people, and it, you know, it depends on your relationship with your provider. Some people are in the camp that there are no diet changes, and some do believe in diet changes. So definitely, it's not consistent. But the next question is from Michelle, and she mentioned that she had a uterine artery or a uterine embolization procedure done to shrink her fibroids and had some complications as a result. And she hasn't been having consistent cycles since then, and she wants to know what questions she should be asking to find out if everything is okay. So my answer to that is to definitely follow up with your provider on Monday and let them know that your cycles have not been consistent, and see if you can get an appointment scheduled. And I'm not sure, like, it kind of depends on the size of your practice. And, you know, if it was an interventional radiologist, like Michelle, we could talk offline about this. I could, you know, give you some advice. It kind of depends on the setup that you have, because I know that usually an interventional radiologist does those procedures. But I would follow up with the GYN about the cycles being inconsistent, and if you could schedule an appointment to see, you know, what's going on with that, because they may want to work you up. It's probably a variety. It could be a variety of things, but I would ask for a visit because you have concerns that you don't think that that's normal at a baseline. That's what I would ask. Do you have any recommendations?
I agree. I would definitely say the same thing, is to follow up immediately with whoever did the procedure. But and if it was the radiologist, and also with your gynecologist, there are a plethora of tests that they can run, blood tests that they can run to see if it is a matter of, you know, potentially, you know, I hate to say, but like potentially like menopausal, like, you know, going in that direction. But so I would definitely reach out to the radiologist who did it, but also the actual gynecologist as well, your primary gyne as well. And if you feel that you're not going back to, if you feel like you're not getting the answers to those questions that you need, then, you know, definitely seeking another opinion as well.
I agree, because it could be that they want to do like ultrasound to kind of look at your uterus. It could be that they want to do blood tests to kind of see where your hormone levels are. It's a variety of things that they may want to evaluate. Or it could be, I'm not sure, it could be, you know, symptoms of having the procedure. That could be normal, but I'm unsure, but I would definitely follow up.
Absolutely. So thank you again to Meredith. Definitely appreciate you. I do want to share that we have, if Jasmine Hall can get ready to come up next with our gentle chair yoga session. Jasmine Hall, I'm so happy to say this. Jasmine is a native of Flint, Michigan. She is a Harvard graduate. She graduated with her Master of Public Health from Harvard University. And she created We Are Healthy and Well. And so she's going to be with us to share a gentle chair yoga session. I do want to share that I see Trisha's on here. Trisha Edwards was the first winner of the giveaway. And then the second winner of another giveaway is Tiana Richardson. So congratulations. So far, we still have one more giveaway. So far, Tiana Richardson and Trish Edwards are the winners of the two giveaways. One more left. While you're at it, remember, follow Advocating for My Uterus on Instagram, as well as the website. Please go to the website to subscribe. Advocating for My Uterus is a nonprofit organization. None of us receive any money. Every money that all dollars that come in goes back out to the community. Even the book that I'm writing the book. I will not receive any money. All of the proceeds goes straight into the organization so that we can help women if they're having surgery and may not have the money to get some things for surgery, to get the binding belt, that's the best way I can call it, I don't remember the name, or, you know, Mederma for their scar, whatever they may need, but then also to, again, assist with high school students who may not have the means to be able to buy pads, tampons, etc. So with that, Jasmine Hall is up now for the yoga.
Thank you. And how many minutes do you want me to do?
So we have about 7 to 8 minutes.
Okay, perfect.
Okay.
Hi, everyone, and welcome. We will just begin in a comfortable seated position, kind of moving forward so that there's some space between you and the back of your chair. And then just begin to notice your breath. You want to make sure you found that comfortable position, maybe grabbing a pillow. Just begin to notice your thoughts, gently acknowledging them, coming back to your breath. We'll take a deep inhale through your nose. And as you exhale, feel free to soften your gaze or close your eyes, whatever feels good to you. And just continue breathing in and out through your nose. I invite you to set an intention for the next few minutes in this session and an intention for your week. On your next inhale, lift your shoulders up towards your ears and exhale, rolling them down your back. Again, inhaling and exhale to release. One more time, inhaling and exhaling. On your next inhale, shine your heart forward, send your gaze up. And as you exhale, round your spine, chin to chest. Inhale, look up. And exhale, round your spine. Inhaling up to neutral. And as you exhale, bring your right ear over to your right shoulder. Taking a full cycle of breath here. And inhale up through center. Exhale, left ear to left shoulder. Inhaling through center. Exhale, reach your arms out wide and bring your fingertips to your shoulders. And as you breathe, just begin to make circles going forward and then backwards. Exhale, release your arms out. Begin to make small circles going forward and then backwards. Inhale, reach both hands forward, palms down. And exhale, flip that right hand onto the left and up. So right hand on top of your left. Left palm faces down, right palm faces up. And then turn your hand so that your pinkies are down and your thumbs are up. So right hand over left. And as you exhale, bring your thumbs towards your face, lifting your elbows so that they're in line with your chest. Inhale, sit up nice and tall, and exhale through your nose. Inhale, nice and tall. Exhale, send your fingertips out to either side. Inhale, bring your hands forward, this time left on top of the right. Then flipping that left hand over. So right palm faces down, left palm faces up. Turning both hands so that your thumbs are up, pinkies are down, left hand over right. Inhale, sit up nice and tall, and exhale, bring your hands forward, lift your elbows, and breathe. Inhale, nice and tall, and exhale, release your hands down to your knees. We'll inhale, bring your hands through heart center. Exhale, open out your twist to the right. So right hand reaches back, left hand reaches forward, gazing at that right hand. Inhale, bring your hands back through heart center. And exhale, take it over to the left side. Left hand reaches back, right hand reaches forward. Inhale to lengthen your spine. Exhale, see if you can twist a little further to the left. Inhale, hands come back to heart center. Take a few breaths here. And then heel toe your feet out so that your legs are wide as is comfortable. Maybe adjusting your seat, coming forward. And we'll reach that right hand straight down in front of us. Left hand comes out on your inhale. And as you exhale, reach that left hand straight up. Right hand reaches towards the ground, gazing at that left thumb. Coming back to your breath or your intention here. We'll inhale, reach our arms straight out. And exhale, take it over to the left. Right hand reaches for the sky, gazing at that right thumb. Gently acknowledging any thoughts that come up. Compassionately, and returning to your breath. We'll inhale up through center and exhale, palms come together. You can heel toe your feet in a little wider than shoulder distance apart. We'll inhale, reach your arms up, palms together. Exhale, gaze up toward the ceiling. Inhale, lengthen. And exhale, look a little further. Inhale, nice and tall. And as you exhale, come forward into a forward fold. Inhale, hands come up to your knees. And exhale into a comfortable seat. And we'll go back to our cat-cows. So inhale, shine your heart forward, gaze up. Exhale, round your spine, chin to chest. Inhale, gaze up. And exhale through center. Inhale, nice and tall, hands at heart center. Exhale, we'll twist open to the right. Inhale, hands come together at heart center. Exhale, twist open to the left. Inhale, hands at heart center. And exhale, bring your hands back down to rest on your thighs. We'll take a few final moments here. Just breathing. Inhale, reach your arms out nice and wide. And exhale, wrap your arms around your body, just giving yourself a gentle hug. Maybe rocking here. Just sending some gratitude to our bodies for carrying us. We'll exhale, releasing our arms out to the side. Inhale, reach up, hands come together. Exhale through heart center. I want to thank you for taking this time to practice. I invite you to just send some gratitude to your creator, to your God for this time. I invite you to send some gratitude to yourself for sticking around, carving out a little self-care on this Saturday. The light in me sees and honors the light in each one of you. Be well, yogis. Namaste.
Thank you so much, Jasmine, for that. The reason why I want to do that is to wrap up this day. We've talked about a lot of heavy things, and just want to make sure that we end it with some relaxation, with some mindfulness, meditation, and some exercise. With that being said, again, thank you. Thank all of you. Please remember to stay connected, advocatingformyuterus.com in terms of the website, and then advocating for my uterus on Instagram. As a final reminder, thank each of you for participating in the discussion and the conversation. And the last winner I wanted to share is actually Kalisha. Kalisha, I apologize if I'm pronouncing your name wrong. So Kalisha is the third winner. So we have Trish, Tiana, and Kalisha. Again, I apologize if I'm pronouncing your name wrong. So congratulations to all the giveaway winners. Again, please ensure that you are taking time to advocate for your uterus, but even beyond that, advocate for your health, the health of your family members as well. Please remember to take time to advocate for your mind, your mental health. Again, if you need to see a therapist, please go talk to someone. Consider reaching out. If you've been thinking about it, consider this the confirmation that you need to go ahead and try to find a therapist to actually talk with. And lastly, remember, if you are dealing with fibroids, ensure that you are asking the right questions, that you're asking your provider questions. If you don't necessarily feel comfortable, or if you feel like you want additional information, please know that you can absolutely try to get a second opinion, to go somewhere else, get a second opinion. Blackdoctors.org. That is a site where you can, where you can find, if you are looking for a minority physician specifically, then you can go to blackdoctors.org. They also have a Facebook page. And lastly, if you know someone who has been diagnosed with fibroids or any condition, please ensure that you are giving them what they want, not what you think they want. When people sometimes say that they need their space, it has nothing to do with the individual. So even in terms of preparing for this conference, I'm someone, I have to take time to get my mind right. And so I tend to shut down so that I can prepare. There's a lot of prayer that goes into anything that I do, especially when I'm dealing, when I know that it's something that God is telling me to do. And so make sure, again, that you're giving those individuals what they need, what they want. And if they're asking for space, please ensure that you're doing that, because sometimes when what we're thinking is helping is actually causing more stress and anxiety with the individuals. Lastly, I just want to end with one final poll. And that is, if you can just share which topics are you interested in learning more about. We are going to do some other sessions on endometriosis, polycystic ovarian syndrome, menopause, egg preservations, or just how to advocate for your health. Please feel free to share. I'll just give a couple more, like 30 more seconds on this. Okay, so I see how to advocate for your health, menopause, polycystic ovarian syndrome actually got the highest. And there are a couple who are interested in learning more about endometriosis as well as egg preservation or egg freezing. Thank you all. This information is extremely helpful, and this is going to help us as it pertains to other programs. So with that being said, everyone have a wonderful Saturday. Thank you again for spending your Saturday with us. And please do your part as it pertains to fibroids. Please share this information with other individuals. If you have subscribed to the website, you are going to receive a link to the actual YouTube video. If you're on Facebook, feel free to share the video. We want to make sure that we get this information out. We saw that over 90% of us said we know someone who has fibroids or who dealt with fibroids in the past. So this is going to impact literally every single one of us. Will know someone who has to deal with this condition. So please ensure that you're sharing the information. Have a wonderful Saturday, everyone. God bless.